I'd like to thank you for your presentations there. I'm from one of the lockdown counties. I'm from County Offaly, but I represent Laois and Offaly. And I completely disagree with the decision. It was completely over the top to lock down 3 entire counties when there were clusters. And we're all told that we have to live with this virus, but I think common sense needs to kick in fast. And very fast. And I want to take up a point there that was raised about economic damage being done by the virus. Not all of the time, no. In some cases, it's done by very poor decision making. And in this case, economic damage is being done in my own county of Offaly and indeed in Laois as well, because of the very poor decision making and knee-jerk reaction to clusters in meat factories, which should have been handled a lot better. And I've said that earlier to the representatives that were in here. But I do want to point out that this lockdown was presented to us in Laois, Offaly and Kildare as it was done in the name of health, but I do want to point out to you that there are many business people very stressed at this moment in time. Now, we all know that stress also brings health effects and indeed implications in terms of their health, and it causes different health problems. But I'd just like you to take more consideration of that. And I'd just like also to know, I mean, was the whole possibility of a targeted lockdown in the specific areas that were affected with the clusters, was that not considered? And I just want to also add here to the record today that it has come to my attention that Tullamore and Portlaoise hospitals have remained clear of cases since the large-scale regional lockdown was announced. And again, I say it was unnecessary, and I'm calling for it to be reversed before more harm is done. And I mean social and economic harm. What's happening here is totally unfair. Dr. Glynn stated earlier in the week that areas like Burr, Ferban, Clara, Tullamore, Edenderry had cases of COVID, but yet he did not specify the number of cases. There was one day this week where the number of cases for Laois and Offaly were not released. But if there was more than 10 cases, we'd know about it. So I'd just like to know what is going on. Because, I mean, people are becoming very, very frustrated. We need to exercise common sense. And I want to know, was an impact study done before decision-making was taken to lock down 3 counties? Because it was absolutely absurd and nonsense and over-the-top idea. And I want to say that I have been speaking to business people who are very, very hurt by this. There was absolutely no consultation done with any business person. If they were given time, and there's lots of talk about we're in this together. No, we're not in this together. No consultation was done with business people in my own county. We've one of our hotels, the Bridge House Hotel, with 230 staff facing great uncertainty. It's unacceptable, and we need to get our act together, but we need to do it in a way that is protecting public health and in a way that exercises common sense and indeed consideration for people. I also want to add to today that I have consistently called for financial packages to be made available, because I believe people were very wrong. They were really wrong done with this whole decision making, and I have done that, and I do hope that there will be financial packages made available. In regard to the nursing home situation, Professor Anthony Staines mentioned that, and I agree, not enough was done, and indeed I raised that. Not enough. It was reactionary. So, we need to be proactive in terms of the nursing homes. But are you confident now that enough is being done? What sort of planning is in place, and indeed what sort of policy making is in place now that will ensure that we can prevent the deaths of our most vulnerable in our nursing homes? And I just want to conclude by saying that common sense needs to be exercised with all decisions. We've handfuls of cases, handfuls instead of what's been reported and what's been incorrectly reported. It has done untold damage that was totally unnecessary to 3 entire counties.
Does anybody wish to comment on that? Because I am assuming that you agree with the approach of New Zealand and the lockdown in Auckland in response to the, and I'm speaking to Professor Carney and Professor Staines, that you agree with the approach in Auckland that there was a lockdown given the number of cases there. So therefore, do you also agree with the approach of a lockdown in Kildare, Laois and Offaly, or do you not? I'd just like you to respond to Deputy Nolan.
Thank you, and I hear Deputy Nolan's frustrations and understand the hugely negative impacts of the lockdowns, and really part of the whole COVID zero approach and our call for a very clear elimination strategy is based on our clear will to try and avoid lockdowns. And I absolutely agree with her that we need to be very proactive here. And the problem is with just making a decision, as seems to be the case at present, of living with the virus, is that we are then exposing ourselves to these events where we will see these increases in cases, and we'll take a kind of a reactionary approach to those. And so I suppose what we're saying is that we need to look at this COVID zero strategy, to look at the implications of it, and has been discussed before, to build the trust with the population, to think about the decisions that will be need to make, really hard decisions and implemented. But the idea then is that we can, by implementing those, working together, get to a point of these green zones where we can start to live normal lives. And I absolutely agree that this, the idea that health and wealth are in some opposition, it just makes no sense. And we know that the economy is just a reflection on the society, on health. It's all of those things that go together.
Well, on the one hand, you say that these type of lockdowns are an inevitable consequence of the strategy that the government has followed, but on the other, you advocate a New Zealand type strategy where there is a lockdown in Auckland in response to 4 cases.
So to be clear, what we're advocating is an elimination strategy, which is what has occurred in New Zealand as well. What's emerging is that the outbreak of cases that has occurred was due to the problems with implementation of the strategy. They've introduced a lockdown very quickly. They've had a very agile response, and the likelihood is they're doing an outbreak investigation that they will be able to return in Auckland to normality as soon as possible, and the rest of New Zealand has largely been able to continue with the normal lives that they had been able to attain. So the difference, to me at least, it's a very different lockdown than what's happening here at present.
Yeah, I'm afraid I thought that the outbreak in Kildare, Laois and Offaly was equally a result of a failure to eliminate the virus. I mean, what's the difference?
So the difference is here we have said that we're going to live with this virus, and we're going to continue to live with it until, and hopefully, a vaccine is developed sometime next year. What we're saying is that we want to eliminate the virus, and that's what's been done in New Zealand. And as a result, there were 104 days where people in New Zealand were essentially able to return to normal. Society was functioning, businesses were functioning. And so the difference here is that we have this lockdown in those 3 counties. It's unclear how long that lockdown is going to last for, what the target is in terms of making the decision. So I thought it was interesting, Deputy Nolan spoke about how the decision was made to implement the lockdown. And with any of these lockdowns, a hard decision is implementing them, but an even harder decision is when you decide to lift those restrictions. And so I suppose what we're trying to convey with this elimination strategy is coming up with very clear targets about what we're trying to aim for, and then also thinking about how we will respond in an agile way if some cases do emerge.